Hi, my name is Dr. Kathryn Martin for Ivy Family Health Updates, and I'm here today with my brothers Dr. John Martin and Dr. Edward Martin. And today we're going to be talking about excess facial hair growth in women, which is also known as hirsutism. And it's a very, very common problem that occurs in at least 5% of women, and that's somewhat variable depending on your ethnic background. And most women who present with excess facial hair growth, about 75 to 80% of them have something that we call polycystic ovary syndrome, which is a hormonal disorder. And in addition to facial hair growth, you get hair growth in other parts of the body in a male pattern, so an androgen or male hormone pattern. So for example, chin hair, hair above the lip, in the sideburn area, between the breasts, maybe on the upper back and the buttocks. So it grows in areas that women are not supposed to normally have hair growth. It's very distressing.
And when you say polycystic, does that just mean that the ovary has a lot of cysts in it, or?
Yeah, it's sort of a misnomer. I mean, polycystic ovary syndrome is also a very common problem in women. It affects about 5 to 10% of all women. It's defined. It's a clinical presentation. So women with PCOS have irregular menstrual periods. They have excessive facial hair and acne, and they tend to be overweight. And they're at increased risk for diabetes. So it's sort of a collection of a number of different problems.
Okay.
So the excess hair, women will present sometimes to their dermatologist, sometimes to their plastic surgeon, sometimes to their primary care doctor, sometimes to their endocrinologist. But a lot of them will have an underlying hormonal disorder.
Okay.
So as far as hormonal testing, does everybody need to get their hormones tested? Not necessarily, because some women might actually come in and they have a little bit of hair growth here or a little bit of hair growth here that can be completely normal for their ethnic background, and they have no other excess hair growth, and that really doesn't qualify as having hirsutism. But for other women, it can be much more extensive, and they probably do deserve some sort of endocrine workup because you want to know if they have polycystic ovary syndrome. In addition, women who have sudden onset of excess facial hair or rapidly progressive facial hair, they need an extensive hormonal evaluation because there are some bad things, some more sinister things that can cause this. For example, different types of tumors in the ovary or adrenal gland, but those are very, very rare. Now for treatments, there are two different types of treatment for this type of hair growth if it's caused by excess male hormones. One is medication, and the other would be sort of hair removal techniques that you have talked about in some of the other sessions, for example, laser hair removal. And I would say that probably both are important for this population. Hair removal techniques such as laser are terrific, and you get great cosmetic results. But if these women are not also on some sort of medication suppression therapy, they're going to get very quick regrowth of their hair when they're using the laser hair removal. So we really, point out to these women, we encourage them to use that if they can, if they've got the resources to do that. But it's really important that they be on some sort of medication. And the medications that we recommend, and we outlined these in a recent Endocrine Society guideline that we published. Our first choice of medication for women before the menopause is a birth control pill. And it doesn't matter which birth control pill, but you get the best cosmetic result. And we think that the benefits of the birth control pill outweigh the risks as the best option when compared to other medications. So we typically will start the pill, and after about 6 months, if women don't feel they've gotten the benefit that they want, we'll add another medication that's called an anti-androgen, or it's a hormone blocker. It sort of binds to the receptor right in the hair follicle and blocks whatever testosterone left over from stimulating that hair follicle. An example of one of those anti-androgens that we use in the United States is called spironolactone. Now, you could use that medication alone, but we really prefer that women of reproductive age not use that alone because there are some concerns that if you're taking spironolactone alone and you inadvertently became pregnant and had a male fetus, remember it's an androgen blocker, you could block the normal development of the male reproductive organs, So we only use it, use a birth control pill first and then add that on. And there's another drug that's used very commonly in women with polycystic ovary syndrome called metformin. It's actually a diabetes drug. Women with polycystic ovary syndrome will know people are handing this out very commonly for all sorts of different reasons to women with PCO. And there's sort of a misconception that it works very well for hirsutism, for excess hair. And in this guideline that we recently wrote, we did what's called a meta-analysis, where you take all of the clinical trials out there and pool them all together and sort of come up with the estimate of whether this treatment really works or not. And the bottom line is it's really not effective for hair growth. So it may be effective for other things, but you don't use metformin to treat excess hair growth. So really, basically, the birth control pill, with or without spironolactone, but with those two drugs, you get a very nice cosmetic result. And then, you know, with the electrolysis, really, women can do quite well.
Is you talking about lifelong treatment now, or is at some point do the hormones change? And
That's an important question. We have found in some of our own work at Mass General that eventually testosterone levels begin to decline, if sort of in their 40s and 50s. They never reach the levels of women who don't have polycystic ovary syndrome. And you know, anecdotally, there are no big studies looking at this. In our experience, women with history of polycystic ovary syndrome never get to the point where they feel like their hair growth is under control. They never get to the point where they feel normal. So it's really a lifelong struggle.
Now, does pregnancy affect the hair growth at all?
It does to an extent, just the very, very high levels of hormones. Estrogen levels get so high, progesterone levels get so high, so the sort of balance of estrogen to testosterone, which is still there, is a good one, and so it does suppress some of the hair growth.
You know, it's interesting that, you know, doing a lot of hair removal with a laser, we definitely see some women who just, it's either very hard to get rid of the hair, and there's an interesting phenomenon that happens sometimes where you'll get rid of the hair here, and then all of a sudden people will start to grow hair in a new area. Mm-hmm. So certainly you would wonder then, is there something hormonal going on that's, you know, you've knocked out some, and so the androgen would now be sort of triggering hair in a new area. You know, which
it could be.
We talk about it in meetings, but no one's really brought that up in terms of polycystic ovary maybe, or the androgen.
It certainly could be.
Being possible for that.
Very possible.
All right. Very good. Thank you very much.
Thank you.